Targeted Probe and Educate is back for home health and hospice providers. You might be wondering what the current state of TPE is. Well, stay tuned as we take a look at the current state of TPE and common claim denials for home health and hospice and how to avoid them. TPE medical review audits launched by CMS in 2017 have been resumed after a pause due to the public health emergency. Home health providers are largely denied claims related to certification requirements, face-to-face encounters, and lack of documentation that supports medical necessity and skilled need. Hospice providers mostly face denials from insufficient documentation proving terminal prognosis of 6 months or less. For both home health and hospice providers to avoid financial repercussions, it is important to implement systems that ensure compliance with Medicare conditions of payment and provide appropriate documentation that supports medical necessity and certifications. If not done correctly, these organizations may face denied claims resulting in financial losses. Targeted Probe and Educate is an audit process used by Medicare administrative contractors to ensure that home health and hospice providers are compliant with Medicare regulations. Claims are evaluated using additional documentation requests, ADRs, and Medicare MACs have 30 days to review. Depending on the MAC, a successful error percentage must be lower than 25%, 15%, or 20%. Each failed round of review, the agency is subject to an education call and a wait period of 45 to 56 days to correct their issues and then an additional round of review. If the agency fails the third round, they will be referred to CMS for an additional action which can result in a UPIC or SMRC audit. Data analysis from PEPA reports is used to identify areas of greatest risk for inappropriate payments. Now let's talk about the top active medical review edit reasons for TPE. For hospice, it is length of stay greater than 730 days with non-cancer primary diagnosis, Q codes reflected on the claim for hospice services and nursing facility, Q5003 and Q5004, and new providers who have submitted at least 50 claims. For home health, we have medical necessity, claims with 2 to 6 visits and select diagnosis codes, home health services, length of stay, and new providers who have submitted at least 50 claims. Let's talk about the top claim denials for hospice and how to avoid them. The number one denial reason is 6 months or less prognosis not supported. This is by far the number one reason for hospice denials regardless of the reviewer. Eligibility requirements being met upon admission is only the beginning. Throughout the care of the patient, there must be continued documentation to support the terminal prognosis of the patient. The second denial reason is the Medicare benefit election statement is invalid because the statutory regulatory requirements are not met. With the changes that occurred to the election statement requirements in October of 2020, there have been even more denials for the election statement being invalid. Hospices must ensure that the requirements for data inclusion on the election statement are met and that each one is completed to standards when an admission occurs. In addition, hospices must be diligent about the addendum requirements as this is a condition of payment. The third denial reason is the physician narrative statement is missing or invalid. Some hospices are still unclear that the certifying physician is 100% required to be the author of the narrative statement to be included in the certificate of terminal illness. Having your software system print out a generic certification statement and having the physician sign it with no clinical content specific to the patient, that's a denial waiting to happen. The CGS Medicare MAC reported that July through September 2022, 59% of claims reviewed did not support a prognosis of 6 months or less, and that 29% of the claims denied were related to Medicare benefit election statement requirements not being met. These findings are similar for NGS and Palmetto GBA. We've covered hospice, so let's take a look at home health top claim denials and how to avoid them. The number one home health denial reason is skilled nursing services were not medically necessary. One of the best practices in avoiding this denial is routinely performing chart reviews to ensure there is documentation to support a skill was performed at each visit that includes the patient's response to treatment, progress towards goals, and the plan for the next visit, and that homebound status is supported throughout the episode. The plan for the next visit has surfaced as one of the top reasons for denial. The second denial reason is the face-to-face encounter is missing, incomplete, or untimely. This denial has been in the top 3 denials since the requirement was implemented in 2011. Agencies must verify that the face-to-face encounter visit for the initial certification is incorporated in the patient record and was performed timely by an allowable practitioner, supports the primary reason for home health services, and is signed and dated with a valid signature by the allowed practitioner that conducted the encounter. The third denial reason for home health is the initial certification is missing, incomplete, or invalid. Agencies should have a process in place to ensure the 5 required elements of the initial subsequent certifications are met prior to billing the claim. There must be support that elements are present, signed, and dated by the certifying physician. The CGS Medicare MAC reported that in July through September 2022, 43% of claims reviewed did not support medical necessity for therapy services provided, and that 45% of claims denied were related to the certification plan of care requirements not met, including face-to-face encounter denials. These findings are similar for NGS and Palmetto GBA. It is important to ensure compliance with Medicare regulations and provide appropriate documentation to support medical necessity and certifications to avoid financial repercussions from denied claims. If your agency is facing medical review audits or denials, don't hesitate to reach out to Healthcare Provider Solutions. Our clinical consulting team can assist with chart reviews, appeals, staff education, and so much more. Thank you for watching. Be sure to like and subscribe, and we hope this information was helpful to you. See you guys next time.